Hi, my name is Natasha Billick, and today I will be performing a respiratory assessment. Before patient and environment contact, I will be performing hand hygiene.
Hi, come in.
Good afternoon, how are you today?
Fine, thank you. How are you?
I'm fine, thank you. My name is Natasha, and I'm a level 2 McMaster nursing student. Do you mind if I ask for your name and your date of birth?
Of course. My name is Haley Billick, and I was born on June 3rd, 2002.
Excellent. And what brings you here today?
I would like a respiratory assessment, please.
Okay, so just so you know, that should take no longer than about 10 minutes. If you have any questions over the course of the assessment, please don't be afraid to ask me, and I will try my best to answer them. Just so you know, before we begin, anything that is said today will remain confidential between you, myself, and the rest of the healthcare team, unless you express that you intend to harm yourself or others, and then other people will need to get involved. Okay?
Okay.
Before we begin, are you comfortable?
Mm-hmm.
So at this point, in our interaction, I would be performing a general survey, so this typically wouldn't be verbally expressed, but for the purpose of this assessment, I will be. So first off, in terms of appearance, my client expressed that she was born in 2002. This would make her 17 years old, and I would say that her age seems to be appropriate for her appearance. Her facial symmetry is intact. She's maintained eye contact with me, which shows that she is both alert as well as oriented because she's been able to answer my questions. In terms of mobility, I'm not able to assess this as of yet. Body structure, her posture is erect. I don't see any evidence of any kinds of lumps, masses, or physical deformities that are present at this time, and her height as well as her weight appear to be quite healthy. And finally, in terms of behavior, as I mentioned earlier, she has maintained eye contact with me. She is dressed appropriately for the situation, and she also appears to be well-groomed as well as hygienic. So now I'm going to be moving on to asking you some focused questions about your respiratory health history, okay? Do you have a cough?
No.
Any shortness of breath?
No.
Do you experience chest pain when breathing?
No.
Do you have any past history of a respiratory infection or disease?
No.
No, nothing even as mild as asthma?
No.
Okay. Do you have any family history of respiratory diseases?
No.
No evidence of lung cancer or maybe chronic obstructive pulmonary disorder?
No.
Okay. Are there any environmental conditions that affect your breathing?
No.
Do you live close to heavy traffic?
No, I don't. I live in the country.
Okay, excellent. So now I would be performing a complete set of vital signs on my patient, but due to the limited equipment that I have in this environment, I would be unable to assess these completely. So first off, I would be performing a blood pressure using the two-step manual method after identifying the brachial artery above the antecubital space on our arm. An ideal BP based on Potter and Perry is 120 over 80 millimeters of mercury. I would be identifying her pulse. Her heart rate would be found from her radial artery, which is on the thumb side of her forearm. Her heart rate should be anywhere between 60 to 100 beats per minute for her developmental age. Furthermore, I would also be finding her respiratory rate, which should be between 12 and 20 breaths per minute as defined by Potter and Perry. I would also be finding her temperature using a probe that would be pushed into her sublingual pocket. Her temperature should be between 36 to 38 degrees Celsius, varying slightly if she has eaten or had anything to drink recently. And lastly, in a hospital setting, I could also identify her O2 saturation, which should be above 95%. So now I'm going to be moving on to the actual respiratory inspection. So first off, I'm going to be inspecting her posterior back. I don't see any kind of lumps, lesions, or masses, no kinds of scarring or bruising. Her neck and trapezius muscles look to be developmentally appropriate for her age. Her spinous processes are in a straight line. Her scapula are symmetrical. She has downward sloping ribs. If I inspect the antero to posterior transverse diameter, it is about 1 to 2 to 5 to 7, which is appropriate as defined by Potter and Perry. I will now be locating the lobes of the lung. There are 3 on the right side and 2 on the left side, though posteriorly you can only see 2 on each side. Posteriorly, they extend from about T1 down to T10, and anteriorly from above the clavicle until the 7th rib. Next, I will be moving on to palpation. I'm going to use my fingertips to identify any masses, lumps, or lesions present on her back, of which I don't feel any. I'll use the back side of my hands. and this is to identify temperature, which is even symmetrically and bilaterally, as well as no evidence of any kind of moisture. Her back is dry, which is appropriate. I will now be palpating at the level of T9, T10. If you could breathe in and breathe out. And there was symmetrical expansion of her rib cage. I'm now going to be using the ulnar edge of my hands to assess for tactile fremitus. So once I place my hands down on your back at 5 locations bilaterally, could you please say 99? Say 99.
99, 99, 99, 99, 99.
Excellent. So when I palpated, I felt normal vibrations symmetrically and bilaterally throughout. I'll now be moving on to percussion. I'll be using my middle finger and moving down bilaterally in 9 different spots in between her ribs. All right, and so I've heard decreasing resonance as I move down the lobes of her lung, which is a normal finding. Finally, I will be moving on to auscultation at these same 9 locations. Haley, I'm going to have you take a deep breath in and take a deep breath out every time I place the diaphragm of my stethoscope on your back, okay? Alright, now that I'm about halfway through, I'll just have you take a deep breath on your own pace, because I know that this can be a little tiring. You feeling okay? Mm-hmm. Alright, so I'll continue. And last one. Excellent. So I heard no adventitious sounds, no evidence of any kind of crackles or wheezes, which would be abnormal findings. There were clear breath sounds throughout. Closer to the middle, over the main bronchi, I was able to hear bronchovesicular sounds. I could hear vesicular sounds towards the lobes of the lung on more of the lateral portions. I could not hear bronchial sounds, as this is only anteriorly over the trachea. So that concludes the respiratory assessment. Just to finalize or to summarize my findings, upon inspection, you had a normal skin coloration, no evidence of any kind of use of accessory muscles. You had no lumps or masses that were present that I could see. You had downward sloping ribs, straight spinous processes, as well as symmetrical scapula and well-developed muscles. I palpated, I could feel even no tenderness that you reported. There was no evidence of lumps or lesions that I could feel. I could feel a normal temperature and it was nice and dry throughout. And you had symmetrical chest expansion at the level of T9 or T10. I then percussed and I heard decreasing resonance down your lungs or down the lobes of your lung. And upon auscultation, I could also hear no adventitious sounds, which would be abnormal. So do you have any questions for me? I know that was a lot to take in.
No, I have no questions.
All right, excellent. So you can speak to our receptionist about any potential follow-ups, and please don't hesitate to give us a call if you have any respiratory symptoms that come up. Thanks so much for your
Thank
time.
you.
Have a great day.
You too.